I must mention that this should be our last press conference for the summer. But before we get to our remarks, I would like to take a few minutes to congratulate Dr. Drouin. The Minister of Health, Mr. Dubé, renewed our regional director's mandate for Montreal. So this is a mandate that will go until 2025. So I'd like to wish you, Dr. Drouin, the best of luck. And actually, this nomination should please all Montrealers. And I think that you were very present during this pandemic, and we are fortunate to have had you.
As I just said in French, I would like to congratulate Dr. Drouin. The Minister of Health has renewed her mandate until 2025 as Regional Director of Public Health of Montreal. This is really a good news, and your nomination is one for all Montrealers. I wish you success.
Merci beaucoup. Merci, Madame.
Thank you very much. Thank you, Mrs. Bélanger. It's a pleasure for me to continue to serve Montrealers and to work at keeping Montrealers healthy and protecting them against threats, but to continue to fight against social inequalities in health. So we will work on other determinants in COVID shortly, and this threat for me, well, it's a pleasure to have my mandate renewed, and I thank you for your vote of confidence.
I just want to say I'm quite happy to continue this mandate to maintain Montrealers' health and to protect them from to protect their health. And I think we will have the opportunity to work on other determinants of health than COVID, I hope so, in the next 4 years. Thank you. Alors, bonjour à tous.
Hello, everyone. Thank you again, Mrs. Bélanger. So we're really at summer's door, and I would say that Montreal is in an excellent position, and all of our indicators continue to improve. We've got 324 new cases, an average of 46 a day over the past week. There are a few neighborhoods with rates that are a little bit higher, but overall, the rates are decreasing, and often it's associated to a specific outbreak in an environment. So a rate of positivity at 1.1%, and 47 active outbreaks, small outbreaks, and we know that with the closure of schools this week, we will have a decrease in the number of outbreaks. Even as we went to the yellow alert level and we opened up several sectors, we did not see an impact on the number of cases and outbreaks, which is very positive. It's probably linked, of course, to the combination of several factors. The seasonality, we know, like last summer, the virus has a tendency to eclipse itself during the summer, and the success of the vaccination campaign, and probably also the fact that we avoided the third wave. So we started at a lower plateau. So this decrease was done much quicker. Like the Premier announced, if the trend continues, Montreal, like other regions, will go to the green alert level as of next week, which means there will be new easings of measures. So, of course, we'll be able to take advantage, to see our friends and loved ones, to take up activities that we had left aside and take advantage of the summer. But the message that I have, as was said by the provincial government, this is not over. We cannot stop making efforts. And the question of the Delta variant, of course, is the element that concerns us and for which we have to stay vigilant, even if now we clearly see that it doesn't yet have an impact on our cases, and the importation is still quite minimal. The Delta variant, as we know, is twice as transmissible as the UK variant. The rates of hospitalizations are twice as high than with the UK variant. And we saw this in several countries, despite high rates of vaccination. we see that there are some significant increases, including with our neighbors in Ontario. Currently, we only have 21 cases that were sequenced for the Delta variant since the end of April. We've got 6 cases, presumptive cases, and in place with all the labs, we've put in place some modalities to be able to detect it very quickly. Now, if we go to vaccination, of course, it's very encouraging, and I really want to thank the population for answering the call. Coverage for the general population at 68%. If we look at just at 12 and up, we're at 78%. A coverage with 2 doses at 18%. However, when we look for certain age groups, we still have some work to do. So with the 12 to 17s, we're at 55%, and the 18 to 29-year-olds, we're at 71%. So that's approximately 80,000 people that we must reach as quickly as possible in order to have coverage of 75% in all our age groups. And also, we have to make some efforts in certain neighborhoods. And we have to keep in mind that to travel, to go back to school safely, which will allow us to leave aside the measures that were in place, the mask and physical distancing, and doing activities, sports activities in schools, we must be vaccinated and we must get 2 doses, especially with the arrival of the Delta variant. It will arrive. We just don't know when. So I'm asking young people, I'm asking their parents, young adults, please do not hesitate to go get this vaccine. It's truly a collective effort that is required. In Montreal, we know the variant will probably come through Montreal, so we must make sure, we must put up a wall of collective immunity to make sure that we don't create outbreaks and super spreader events in certain neighborhoods or in certain groups. We will continue on our end. We'll continue with a lot of strategies to reach the 12 to 17s and the 18 to 35s. But overall, if you come to us, it will help us to reach our objectives much quicker. So with the opening of the borders, of course, with the deconfinement, we're not using all the measures. There are some measures that are required in terms of distancing and the mask wearing, the number of people allowed, whether it's indoors or outdoors. We have, it's important to respect these measures because, of course, this is what will allow us to continue to stay in the green level. And when we have a variant case that comes in, we'll be able to detect the changes of transmission and to eradicate it. And, of course, I would end by asking you to go get vaccinated, of course. If you haven't had your first dose yet, please go quickly so that you can get your second dose before the end of the summer. And the second dose as well is very important. That is the one that will give us true immunity. So I hope, like Mrs. Bélanger said, that this is our last press conference of the summer. I thank you, and I wish you a wonderful Saint-Jean. Thank you, Dr. Drouin. As usual, I would like to give you some information concerning the situation in Montreal when it comes to the healthcare network. Currently in Montreal, we have 78 people who are hospitalized, including 26 in intensive care. So you have here the evolution of the hospitalized patients since the 3rd of December 2020. So you can see the waves that we had. And since, for the past 12 days or so, we're below 100 people who are in hospital. We can see it. This is another plateau here that is maintained. And naturally, we want the number of cases to decrease in the community, and we hope that this will be reflected in hospitalizations. So I think the table speaks for itself. We're very pleased, a lot less pressure on in our intensive care units amongst other departments. However, the emergency departments, the emergency rooms in Montreal are very busy. We have rates of occupation that vary between 110 to 170%. So it's huge. A lot of people going to the emergency room. I think it's going to be very important that people can go back to their family doctors and to clinics and walk-in clinics as well. The vaccination campaign, Dr. Drouin mentioned it. I think that since we've had our last press conference, people went and got their vaccine, their first dose. We're starting with the second dose. I want to show you a few results this afternoon. So we can see here quite clearly that for the 45 and up, we've reached our objective. When we're in the blue here like this, and in dark blue here, that means that when you don't see any gray, that means that we have surpassed our objective. We're at 80, 85%, even 90% per age group. Where we must put the emphasis over the next few days. And very quickly as possible, it's truly with the 12 to 45-year-olds in Montreal. So over the 12 to 17-year-olds, we've got 13,464 young people that we have to reach in Montreal. For the 18 to 24s, 25,000 people to reach in Montreal. And for the 25 to 35-year-olds, we're talking about approximately 30,000 people. So around 90,000 people in all, 90,000 Montrealers who have yet to get their first dose. And of course, we have begun administering the second dose. The availability of vaccines is there. They are available. We have staff available. It's not because the summer is here that we will slow our vaccination activities. To the contrary, we will continue to accentuate and to vaccinate where the population is. Amongst others, I would say in clinics or pop-up clinics, in the parks, in different events. You've seen with the Groupe CH at the Bell Center, but also on the Circuit Gilles Villeneuve. There's all sorts of other initiatives throughout the city, so it's important. Please don't hesitate. The information will be communicated. And also pharmacists, your neighborhood pharmacists, these are places where you can also get a vaccine. I would also like to say that you will see in Montreal streets mobile vaccination trucks. There's already some in the northern Montreal, in Montreal North, and there's some in the east, but there will be one in the siège du Centre de l'Ouest de l'île de Montréal, which is launched. It was launched last week. They started with its Vexi van, so it's a van for vaccinations. So don't be surprised if you see it. It's our staff in there. And in the Centre Ouest, they're working with Jean Coutu and Brunet pharmacies, and they will travel throughout the neighborhoods. The group that is privileged, well, actually, all those who haven't received a first dose, but the people we're really looking for is our 12 to 35-year-olds. We really have to do all that we can to vaccinate these people. So that's it. The message is, well, we're not stopping our vaccination this summer. We're continuing. And I would like to wish all Montrealers a wonderful Saint Jean-Baptiste.
Hi, everybody. Good afternoon. Summer is coming, and I think Montreal is in a good position with all our indicators being decreasing. We have an average of 46 new cases each day last week, and a positivity rate at 1%. So it's quite encouraging, and we have really a reduction in the number of outbreaks in different settings. Knowing that schools are going to close, we're going to see this drop continue. And what is quite important to say is, even though we have passed from the orange to the yellow zone with a reopening of different indoors activities, we haven't seen an increase in the number of outbreaks. With this tendency, as the Prime Minister announced, we will be passing in the green zone next week, with new possibilities to see families, friends, to do some activities and some gatherings in some contexts. But of course, we still have some measures to respect. It is not finished, and we don't want to see all our efforts going down the drain. As the thing that is preoccupying us is really the Delta variant, knowing that it is more transmittable and also more virulent. And we are looking at what is happening in Ontario, in Europe. We know that usually it comes in big cities, so we are really aware, and we will still have a suppressive approach for this variant. At the time we're speaking, we had 21 confirmed cases that were sequenced in Montreal since the end of April. If we look at the vaccination campaign, I would say thank you to everyone, because it is a success for all Quebecers, but also for Montrealers. We have a coverage rate for the general population at 68%, and when we look at the 12 and older population, 12 years old and older, we have 78% coverage. For the 2 dose, we're at 18%. Where we still have to do some efforts, it's really for the 12-17 group with 55% of vaccination rate, and the 18-29 group where we still have to reach more young adult. And what I would like to say is, if we first want to travel, if we want to reopen school in September, knowing that we may have a rise in number of cases, and we want to make sure that the schools are secure, that we can reduce the measures in place, that we can people can access sports, parascolaire, we have to have a high level of vaccination coverage rate of more than 75%, not in the general population, but in each school. And this is what we're going to work on all summer, to make sure that we reach those populations where the rates are lower. So I would like to say thank you to the Montrealers, because we are in a good position, and I think we all contribute to this. We still have to be vigilant. It is not because we are in the green zone. The green zone is an alert zone, but it is not a reopening of every activity. So still, please be vigilant if you're not with people that have had their 2 doses. And of course, if you haven't had your first vaccine, get it as soon as possible, and if you can, and the same for the second dose, because it is the only way. It is with 2 doses that you really have a full immunity. Thank you, everyone, and it is going to be the last press conference. I hope so. If we see each other this summer, it's because there's something going on. And I want to say to everyone, happy Saint-Jean-Baptiste. Thank you.
Thank you, Dr. Drouin. In Montreal at this time, 78 people are hospitalized with COVID-19, and 26 are in intensive care unit. The curves of hospitalization keep going down, especially since the last 10 days. The situation is also under control in emergency rooms in the city. The average occupation rate is 110%. All the indicators are decreasing, which is a good news. I want to say a few words about the COVID-19 vaccination campaign. Since we last met, Montrealers have continued going to the various vaccination sites. As you can see, 2 profiles emerge from the groups vaccinated. Here we see that the rate of vaccination for people aged 55 and older is over 80%, which is excellent news. In this second segment of the population, those aged 12 to 49 has not yet reached 75%. We need to achieve this rate in the next few days. It's very important. It's true that vaccines for younger peoples have only recently been available. The school year is ending. Lately, the weather has been great, and there's energy in the air. The Habs are doing really well. These are good days. It's time to extend an invitation to everyone, especially young people aged 18 to 35, to put this energy toward getting vaccinated. Vaccination is the only path to normal life, which is right at the tip of our fingers. The Minister of Health told us recently that Quebecers are among the most vaccinated against COVID-19 in the world. We need to maintain our motivations and to keep at it. To do so, we need the support of young people to get back to normal life. Just like their elders, young people also want to put the burden of the past year and a half behind them. The vaccine protects you, your family, and your friends. It's all us, all to feel lighter and start making plans again. Most importantly, vaccination is key to avoiding a possible fourth wave in the fall. Remember what happened last summer? We had a taste of freedom, which did us good, but when the second wave hit, it was even stronger and more destabilizing. Now we have vaccines to prevent another situation like this from developing again, and now it's time to act. Finally, I would like to see you, maybe you have seen mobile vaccination vehicles going around different neighborhoods. On Friday, June 18, participation with the Jean Coutu Brunet Pharmacy Group, the CIUS West Central Montreal introduced the VaxiVan. The van will go to areas where rates of COVID-19 contamination are highest and vaccination rate lowest. The initiative targets mostly young people aged 18 to 35. Finally, I would like to see you happy and bonne Saint-Jean-Baptiste, everyone.
Merci à vous deux. C'est ce qui termine cette conférence de presse. Tel que mentionné, aujourd'hui, nous avons peu de temps pour répondre aux questions parce qu'à 3 heures, nos porte-paroles devront quitter. Ça va être une question par représentant. Puis s'il y a des questions auxquelles nous n'avons pas le temps de vous répondre en conférence de presse, on le fera par courriel à la suite. On va débuter par les questions en présentiel. Radio-Canada, une question.
Bonjour, Xavier Savard-Fournier pour Radio-Canada.
Question. In the press conference this afternoon, the Premier Legault and Mr. Dubé said that Montreal and Laval were being watched. Dr. Drouin and Mrs. Bélanger, we said that we were calling on influencers. They wanted to call on community groups. What must be done, in your opinion, to get the trust of these cultural communities? Well, I would say that a lot of things are being done, and they've been done for months and months, because that trust, we work on it for vaccination, but we worked on it for screening and self-isolation, so the links are there. Now we must go reach the last percentages. That's, it's a 20%. That takes 20% of our energy. And we must have strategies in order to reach the 12 to 17-year-olds, but mainly their parents, because, of course, we see that it's related. The parents who are not vaccinated, well, often their children are not vaccinated either. Now we are building throughout all of these local initiatives, but we will add some more. With influencers, we also have what we call the visit of all the place of worship. We've got some relationships with certain communities, and there will be clinics or pharmacies associated to these communities that will offer vaccination and will continue to promote it. We have targeted workplaces as well. The biggest one, the most vulnerable ones, where we've got cultural communities from certain neighborhoods, and we will do some door-to-door. We're already doing that at the community level, but we're looking at our data so that we can be as targeted as possible. We'll always have a percentage of people that we won't be able to reach. There are some people who will not want to get the vaccine. It's not mandatory, but we believe that we are still able to go reach some of them, but it's going to take us a bit more time, that's all.
Oui, ben en fait, simplement, je veux répéter le message que j'ai
Well, I want to reiterate my message. We are not giving up with vaccination this summer as part of the priority activities of vaccination centers will remain open, the mass vaccination sites, and what we are adding is local strategies to really reach and vaccinate where people are. And you will see earlier I talked about the Vaxivan, but we will do vaccination in parks. We will go to places where there are sports teams. So we really want to reach most of our population. There's no reason for us to not reach our 75% and more for the 12 to 35 years old. There's really no reason. Question, Dr. Drouin, back to school without masks, and will we be able to go back to school like that? In Park Extension, we're only at 32%, so will back to school be done without masks? Well, clearly, and when we look at our averages, our regional averages, but we can see this. There are differences depending on the schools and neighborhoods in terms of vaccine coverage in schools. If we see an increase in the fall at back to school, well, clearly, we will know the schools that are more vulnerable, and we'll probably have to keep some measures in place. So that is why we must not only look at the general coverage, but also make sure that in each school, if you want to go back to a normal school life, sports, activities, well, of course, the passport to that is vaccination with 2 doses. If we don't have the 8 weeks, we will go back to school and to give the vaccines where we don't have adequate coverage. English questions?
Dr. Drouin, why is Montreal seeing such low numbers of the Delta variant? Are we screening less, or is this the effect of the vaccine?
I think the Delta variant is going to come. At the time we're speaking, it is surprising that we have so little cases, but we do the criblage, and in Montreal we have linked with the laboratories to make sure that we are able to detect them rapidly. The reason it is quite difficult, of course, we have all the cases that we had were imported cases, but we did not have a lot. We'll see with the reopening of borders if it does increase. But we had a strategy for variants in March. We have a strategy right now, and I think we know the ingredients that we have to put in place to make sure that we suppress the entry of this Delta variant.
Il nous reste du temps pour une dernière question au téléphone. Peut-être juste monter le son avec Tim Sargent de Global. Tim, you can ask your question. Si Tim Sargent n'est pas là, on va terminer notre conférence de presse. Oh, est-ce qu'il est là? Tim? Are you there? Personne en ligne. Alors, c'est ce qui termine cette conférence de presse pour aujourd'hui.
That is all for the press conference today. Thank you all, Dr. Drouin, Madame Bélanger. And since it's our last conference of the summer, I would like to thank the communications team at the Centre Sud, the media relation team, and of course, our team of interpreters, without whom we would have a lot of difficulty broadcasting our message so effectively. Thank you.
Merci.
Sim. Bon, espérant qu'il n'y en aura pas d'autres.
Je reçois un texto pendant la conférence de presse. On est une école avec
Vous êtes le dernier participant à la conférence.
non, ça va arriver plus